Welcome to Cross Section, conversations at the intersection of faith, news, and culture. We are excited to be on YouTube. Please subscribe to the Evangelical Alliance YouTube channel to never miss an episode. Hello and welcome to a bonus cross-section episode. It's just me in the studio and I will be interviewing a special guest, Rachael Maskell. Rachael was first elected the Labour Member of Parliament for York Central in 2015. Prior to becoming an MP, she spent over 20 years working in health, first as a senior psychotherapist in ITU and acute medicine in the NHS, followed by becoming the head of health at Unite Union. Her experience in grassroots campaigning, coupled with her passion for tackling inequality and improving health and social care policy, has shaped her politics during her time in Parliament. During Labour's time in opposition, she was the vice chair of the Health and Social Care Select Committee, where you would often find her interrogating government ministers on its strategy to improving dental care for children or funding for hospice care. Rachael remains one of the few Labour voices willing to champion the rights of the unborn baby and outspoken on proposals to legalise assisted dying in the Commons. In the previous Parliament, she voted against extending abortion rights in Northern Ireland. And now, 9 years on, and as a backbench MP in the governing party, she continues to speak out on the policies of moral and ethical significance. The assisted dying bill going through Westminster has been described as the most significant policy issue MPs will vote on in this Parliament or ever in their political careers. From the very beginning, when the bill was first introduced, Rachael has been outspoken in opposing it. In a letter to her constituents prior to the second reading vote, she said she was extremely concerned that if this bill was to pass, it could lead to coercion rather than protecting people from it. The November vote did not go as Rachael or others opposed to the bill intended, but she has been relentless in raising the concerns as the bill proceeds through committee stage. She has probed both the Prime Minister and Health Secretary in how they plan to invest in end-of-life and palliative care and ensure better access for all. Rachael is the chair of the Dying Well Parliamentary Group and is one of the 23 commissioners of the newly established Palliative and End-of-Life Commission. On this episode, we discussed the Commission and how, as Christians, we can positively engage with MPs ahead of the third reading vote in April. I hope you enjoy the conversation. Rachael, thank you very much for giving up your time this morning and being with us on the Cross Section podcast. I hope it will be one of many times you'll be with us. So we'll get to some of the heavier topics, talking about kind of the issue and the problem of palliative care in the UK and the ongoing debate of the terminally ill adults end of life bill. But I think it'd be really great for our listeners to kind of know the person behind the politics. So would you tell us, when did you first become interested in politics?
I can't remember a time I wasn't. When I was very small, I was drawn into following current affairs. So it's been a huge part of my life.
Incredible. So interest for a long period of time, but is it always been a desire to become an MP? When did that interest turn into kind of a career direction?
Oh, it's never been a career for me, and it still isn't in many ways. I just wanted to, and it may sound a bit of a cliche, help society be a better place in which we can all live. And I just have always asked a lot of questions, like, why are things happening around us? And it just took me in deeper and deeper into this political space. And 10 years ago, I found myself here in Parliament.
Incredible. And you've been very open in other interviews, both Christian media and secular media, about your Christian faith and even within the chamber. How does faith inform your politics and some of the issues that you care about?
Well, again, it's been a huge part of my life since I was a child. So the two, faith and politics, have run a course together and entwined together throughout. And I just believe that we've all got different platforms in which to witness the goodness of God. And for this time I'm in now, this is the platform I've got, and I want to be able to use that for His glory.
Incredible. And so you were elected in 2015, been in kind of the opposition party, but now your party's in government. What are some of the issues for your constituents and nationally that you really, really care about and want to see make a difference?
There are so many things. I mean, we know we're living in a very volatile world at the moment, and I do
Mhm.
take a huge interest in international affairs, from climate and of course the real challenges our planet are facing with conflict. But more domestically, in my constituency, housing is a big issue. Health is a massive feature as well,
Mhm.
and every day we never know what's going to come through our door. But the challenges people are facing in society today are enormous. And I just have, throughout my time as an MP, just wanted to put my arms around the constituency and just keep people safe. And that very much became my thought through COVID, and it continues to this day.
Incredible. And as you rightly say, health is an important policy area, but also impacting so many millions of lives. So, segueing into the issue of end of life and palliative care, why is this such an important issue for you? Very few MPs speak about it in the chamber.
Well, first of all, I was a clinician in the NHS working with people at the end of life. So I've walked with my patients through that period of, um, for some getting better, for some dying. And I just know how important it is for people to have a good death, but also for their
Mm.
relatives as well. And palliative care itself is absolutely incredible. We are leading the world in so much of what we
Mhm.
do, but we have regressed over the last decade. And I think it's really important we acknowledge that. 100,000 people today do not get access to palliative care, often from minoritized communities, often
Mhm.
people from low socioeconomic status. And as a result of that, we've got inequity in the system, and we need to address that to ensure that no matter your background, no matter your wealth or
Mhm.
lack of it, that you can have a really well palliated death. And palliation is not just about your physical health, it's about your psychological,
Mhm.
spiritual, and social health as well. And we need to address all of those factors, and at the end, in that final phase of life.
Incredible. And the point about health inequality and inequity is a point and conversation that we will come on to. But you raised in October at Prime Minister's questions to the government, asking them, is it now the time to start a commission to set up kind of end of life and palliative care? To which I think the Prime Minister gave a non-committal response. But it's incredible that this January, that commission, end of life and palliative care commission, has been launched. Can you tell some of our listeners kind of what is the ambition, the direction for this commission? How is it seeking to improve provision in the UK?
Well, I recognised that the government were embarking on a programme to create a 10-year NHS plan, and I was absolutely determined that palliative medicine was elevated within that. So that's why I call for the commission. Little
Mhm.
did I know that I'll be doing the spade work to get it set up, but that's the way things work. And it's independent of government, which gives it real vigour. And we've been able to draw on the real, not only national experts, but global experts as well in this field, and to listen to how across other jurisdictions as well across the UK, palliative care is really advancing. Often we hear stories of poor pain or symptom control at the end of life, and yet there are interventions that can be made which can make a patient comfortable. It's just not widely known about, even
Mhm.
among different clinicians, and it's certainly not widely accessible. And we've got to change the dial on that. So by putting forward a proposal about a different formulated service, one where people aren't rushed into A&E at the very last
Mhm.
stages of life, but can have the care and support at home with their family around them, is really, really important. So we're looking holistically at what a future service could look like.
And rightly so. And you raise the point around access. And I know one of the kind of future conversations or one of the evidence sessions from the Commission is looking at kind of the commissioning and funding model. And I think very much so the House of Lords published its report in kind of just before Christmas, talking about how there's a 60 million shortfall in funding of hospice provision. partly because the majority of it comes from charitable donations. Does the Commission have a sense of what better funding of end-of-life care looks like, or is that something that you're looking to walk towards in April?
Well, we've got our evidence session to come, but we know that only about 5% of people actually die in a hospice. Most people either at home or in hospital. And as a result of that, we want to ensure that less people are dying in hospital, more people at their place of choosing. And therefore, there will be a change, but there will be a change in funding. We recognise the need to invest in people having a quality service at the end of life, but also it will save a lot of money, because if you think that most people will enter hospital at the last year of their life, averaging about 3 or 4 admissions, if people can be better treated and supported at home, that will bring huge cost savings to the NHS. And it also echoes the shifts that the Health Secretary is wanting to bring in, moving people from hospital into community, ensuring there's digital support available 24/7, and also ensuring we're getting those early interventions, getting in there early, working with patients to ensure they get the care they need from the point of diagnosis onwards.
And just before we transition into kind of the debate of the assisted dying bill in Westminster, I was really struck in an evidence session given by Dr. Jamil Hussain, who is a palliative care physician, talking about her research and continued work with those from socially deprived and racialized communities, and really talking frankly and quite starkly that, you know, based on where you live, it's likely that you won't receive the health and end-of-life care that you desire. Equally, that, you know, your health outcomes are likely to be different, and that you're not happy with the care that you receive. Is the Commission looking into that kind of accessibility of end-of-life, good quality care? And is there anything that you can share from the Commission's kind of direction on that?
Yes, we too have heard the evidence around the inequality which exists in society around access to palliative care. And Dr. Jamila Hussain gave very powerful statistics and evidence about that, but also talked about how people from minoritized communities are getting pushed further away from the health service, not least if assisted dying is introduced. So it will create even greater inequality. And I'm really, really worried about that. So making sure that we have got accessible services is important. If we think about a lot of the hospice sector is dependent on voluntary donations from the public, that's more likely to be in affluent areas than areas of deprivation. So the way the system is built, it will create an inequality, and we've got to ensure that ICBs, the regional boards which have got the responsibility for commissioning services, address that inequality.
Absolutely so. And so for our international listeners, those with medical experts, friends in Canada, keep prompting you to kind of get involved and submit written evidence to the Commission. We'll put a link in our bio for you to do that. And I think you have until the 28th of March. So naturally transitioning into the conversation within Westminster, many of our listeners are wanting the conversation to be about improving palliative care, but unfortunately what's dominating discussion is around the assisted dying bill, capturing the attention of ministers and very much of the media. We have in the Isle of Man last month that they voted to a right to die. We have the ongoing conversation in Holyrood, and of course Kem Leadbeater's bill is currently being scrutinised in committee. So Rachel, you're on the same side, same party as Miss Kim Leadbeater. How have you found engaging in criticising both the proposals but also the legislation before us?
Well, I don't look at the person, I look at the words on the page, and that's very much where my focus is, about ensuring that at this stage, having not supported the bill at second reading, ensuring that if the bill was to pass, that it would be the safest bill in the world. And I've been scrutinising the bill from using my clinical experience as well as my parliamentary experience about how things written in law then work themselves out in practice. I've been looking at how we can improve a lot of the safeguards, better record keeping, how drug control is practiced, but also about the inquiries that doctors have to make of their patients. I don't believe that a doctor sitting in secret with a patient they may not know is a particularly safe practice. It's not how clinical decision making occurs within hospital around complex issues. Normally it's through a multidisciplinary team approach. So this bill, I think, has got many flaws and few safeguards, which convince me that those individuals, particularly vulnerable individuals, are safeguarded against, like from coercion, which is certainly intrinsic within our society, but also in the light that we heard evidence on the committee that 500,000 older people experience elder abuse. We know that doctors haven't picked up that elder abuse in their surgeries. So it says that abuse continues out there and it's not being identified. So why a patient is safe under the terms of this bill at the moment, I can't see it. And that's why I'm very deeply not only disturbed, but distressed about it.
Of course, and as you rightly say, you've been seeking to table amendments that really strengthen the safeguards and much of but those who are vulnerable in community. And it seems that not just your efforts, but many other MPs, the more and more they seek to introduce amendments, that they're being thrown out. Do you think the mood in Westminster is that it's a foregone conclusion that at third reading the bill will pass?
I don't know, in all honesty. I mean, some colleagues are kind of disengaged after second reading and haven't really re-engaged. They're waiting to see what comes out of committee. Even at that stage, some people haven't read the legislation itself, which I find really worrying. Other people are very absorbed and distressed that I've been speaking to. Other people think it's fine. I just think we've got a lot more to do to be able to ensure people are equipped with the real facts and the real risks, because ultimately, as was said by Naz Shah, MP for Bradford in the committee, this could end up being the next Horizon scandal if we get it wrong. And we're all aware of that. And the risks certainly, as I read it, wide open within this legislation.
I mean, we here are definitely with you from the Evangelical Alliance, and many of our members are wanting to engage constructively ahead of the third reading. As an MP, as you rightly say, many are disengaged, somewhat distressed. What would be some of your top tips for Christians in how they engage politicians, some of your Labour colleagues, in understanding the risks around this bill?
First of all, I would actually encourage people to read the legislation. It's not difficult to read, just to get a feel for where it is, or perhaps to look at some briefings on the bill to get a grip of the detail. Detail is what this is all about. And then to go and see your MP. People have a right to go and talk to their MP, and particularly if people are clinicians who've got experience of providing end-of-life care, I think it's really important that you go and meet with your MP, discuss your concerns, and also scrutinise them about how they're working through these processes as well.
Incredible. So you've heard it here first, straight from an MP of great experience and clinical background, in that sense of engage your MP, read the bill, and somewhat ask questions about the MP's position on this bill. Rachael, thank you so much for being on today's episode. We very much are grateful for you and your time and how you're spearheading the conversation of improving palliative care and raising the many concerns with the assisted dying bill in Westminster. Till the next episode, take care and God bless.
Hi, Alicia here. Thank you for checking out this episode. If you like it, please make sure to subscribe or share with a friend and leave a review. Till the next episode, take care and God bless.